Mr. Gates, your foundation is releasing its annual report on the status of the UN Sustainable Development Goals. For the first time in years, progress has stopped, even regressed, because of the pandemic. Could you briefly explain what worries you most about the impact of COVID on the world?
Well, this is our fourth year that we've come out with this Goalkeepers report, and we do it ahead of the General Assembly meeting where they talk about progress on the Sustainable Development Goals, which have ambitious targets for 2030. And every other year, we've been able to report that childhood death is down, lifespan is up, literacy is up, gradual progress that often doesn't make the news because it's a day at a time. It's not a one-time disaster. And so this is very exceptional that we've had to say this year we've been set back, in some cases dramatically, like 25 years of increase in vaccine coverage has gone down. And so the goal here is to have us come up with a plan over the next couple of years to get back to where we were, to bring the epidemic to an end by cooperating on vaccine availability and restoring things like the health system, which that disruption has caused many deaths that aren't directly COVID deaths, but just deaths from measles and other diseases.
Let's talk about the states. The US has been one of the most affected countries in the world. To what extent should the Trump administration be held accountable for the trajectory of COVID in the states?
Well, the United States, you would have expected to manage the epidemic better than other countries. The U.S. Center for Disease Control really is the best in the world. We put a lot of money in our medical systems. We have more diagnostic machines than any other country by far. And yet we reacted very slowly. In February and March, we didn't test the travelers coming back. And so, we're not exemplary in this case. Even today, our testing, you often wait many days. And so the test doesn't have the benefit of telling you that you need to quarantine yourself. And so it's a bit of a surprise. I'm sure there'll be a lot of analysis so that when the next pandemic comes, we don't make the same mistakes.
What's your analysis? Do you blame the Trump administration?
Well, certainly they have to take responsibility that there hasn't been a CDC website that prioritizes even poor people to have access to tests. They're reimbursing for tests that take a long time, which is causing the wrong behavior by the testing companies. The dialogue with this administration has been where they don't want to change anything because they like to say they're doing a good job, when in fact it's really very disappointing. So will voters recognize that? It's a democracy, but the real tragedy here is very large.
Let's talk about the private sector. Business leaders have talked about filling the gaps left by the government's incomplete response. What grade would you give the private sector's effort?
Well, the government plays a unique role that the private sector can never replace. The leadership to tell people to wear masks, the trade-offs of what gets shut down, which has an economic price, but reduces the spread of the disease. Only government can do those things. The private sector is the best at creating new tools, like a new vaccine. And our foundation, because we focus on infectious diseases that kill so many children in developing countries, and we're about health equity, we have the relationships to work with these private sector companies and get their manufacturing capacity up very, very quickly. They're doing a very good job. The innovation on vaccines is impressive. We're very likely by the end of the first quarter to have as many as 3 or 4 vaccines that have completed these final trials, and we'll need to get them out on an equitable basis to the entire world.
Mr. Gates, you've been working for 20 years now to make the world a healthier place, to save lives. On a personal level, how does it feel to be the target of all kinds of crazy conspiracy theories and falsehoods?
Well, our foundation is proud of the progress we and our partners have made, bringing child-to deaths of under 5 down from over 10 million a year now down to less than 5 million. And government aid, including a lot of generosity from Germany, has been key to that. So I agree it's kind of ironic to have people say, when I warned to be ready for this pandemic, to have people say that, no, I'm responsible. Or when we're all about saving lives and we're very proud of the tens of millions that the new vaccine efforts that we've been involved in have allowed, to say that, okay, no, vaccines are causing sickness, or there's something malign in the efforts we're doing. So somehow those crazy ideas spread faster on social media than the truth. But I am surprised to find my name invoked in those conspiracy theories.
You just said it's ironic. You're surprised. How does it make you feel? Can you describe it?
Well, in a way, it's almost humorous, but I have to take it seriously because it could mean that people don't believe in the disease. They don't wear masks, or when the vaccine comes out, that they won't be willing to protect other people by taking that vaccine. So, I am worried that it'll push us in the wrong direction. When we're in the middle of a pandemic, dealing with facts and the truth is more important than ever.
That's a very important aspect as well. Thousands of people, we've just seen it here in Berlin, but also elsewhere, like, for example, in London, have been going onto the streets and demonstrating against COVID response measures like wearing a mask. When you see this, are you concerned about increasing radicalization, at least in parts of the society?
Well, in some ways, the epidemic reminds us that responsible government is super important. And so, it's not clear that fringe elements have benefited. Yes, they can come out and demonstrate, but what percentage of the people really agree with that? I'm hopeful that, people listen about masks. Germany overall has had less deaths than other countries. It's very much a very positive example of calm leadership, and even working not just at the federal level, but working through the health system down through the various states. And, I wish the United States had done as well as Germany has done. So demonstrations like that, it's okay as long as most of the people understand this is a real disease, that wearing masks is very, very important. And those calm, trusted messages are the ones people believe in.
Because you've just mentioned Germany, have you sometimes during the pandemic secretly wished to be in Germany?
Well, of course, I'm not traveling like everybody else. I have had a chance to talk with Chancellor Merkel about how Germany's stepping up, not just for itself, but along with other countries, to get the money so that the developing countries can also get this vaccine. And it's not just going to the rich countries, but going to all the countries of the world. So, we share a commitment that to solve this as a global problem in an equitable way.
Mr. Gates, personally, are you afraid of catching the virus or giving it to somebody?
I'm, trying to behave in a responsible way. The risk for any particular individual is not gigantic, but as a society, by having less contacts, wearing the mask, we can drop exponentially the spread of this disease. So, I don't have a large fear, but I want to be a model of responsible behavior.
Your father is 94, your children are in their 20s. Has Corona somehow impacted the way you interact with your family?
Oh, absolutely. Particularly with my dad, we're extremely careful with him because, as you get older, the risk of this being fatal gets higher the older you are. So, we're absolutely sure that no one who's at risk of having it is anywhere near my father. So yes, multi-generational households, nursing homes. There's a lot of places where creating that boundary can be done well, and we're learning more about that as the disease goes on.
Does hugging, for example, still take place in the Gates household?
Within our family, where we're living as one household, yes. But with other people outside the household, or even with my father, no.
Mr. Gates, what does your mask look like? Does it have a Microsoft logo on it or Seattle Seahawks?
No, I guess I'm not that creative. It's just a black cloth mask that works quite well. I haven't gotten into the fashion statement, but I'm not known for my choice of clothes or fashion.
Mr. Gates, the solution to Corona, at the moment at least it seems, is a vaccine. When do you think will we finally have one that also works?
Well, it's very impressive that we have virtually all the top vaccine companies working at full speed. And there are 6 constructs that are either in the final phase 3 trials or about to enter those. And so I'd expect by the first quarter, with even a little bit of luck, that we'll have at least 3, maybe even 4 of those approved. And then the challenge will be to manufacture them. And, so our foundation's gotten a lot of these high volume manufacturers in other countries to agree to also make the vaccine, which has never been done before. And so we need, if it's a 2-dose vaccine, 7 billion people, we need, almost 14 billion doses, and that's never been done before. So it's almost, this emergency action that requires very novel tactics to get billions of doses during 2021.
Mr. Yates, last question. We've talked about the different approaches of Germany and the States throughout the pandemic, but beyond Corona, what could Germany learn from the States, and what could the States learn from Germany?
Well, the United States actually has been strong in one respect, which is that it's funded a lot of this R&D work. So over 10 billion has gone to the various vaccine companies so they can break even doing this work and go full speed ahead. So that's a case where the U.S. Does deserve a little bit of credit. In terms of the financing to buy the vaccine for the developing countries, unfortunately, the U.S. has not shown up, whereas Germany and also the other European leaders, including France, have been quite good. There's a number of events that have been held. It's called the Act A, is the overall envelope to get all the tools out to the entire world. And Germany's been very generous with that. And I'm hoping even in the months ahead that the U.S. Congress will also put money into that, following a very positive example from Germany.
Thanks, Mr. Gates, and thank you so much for having time for us.
Great to talk to you.